Hi everyone, welcome back. I'm Michael Sandler, your host on Inspire Nation. If you've ever struggled with your health, whether energy and fatigue, blood sugar challenges, autoimmune disorders, heart disease, or more, then do we have the Magnesium Miracle show for you. Today I'll be talking with Dr. Carolyn Dean, the undisputed magnesium queen of the world. She's a global leader in the magnesium movement to help us heal all of us, and the award-winning author of at least 33 books in print and well over 100 in Kindle, especially on magnesium, including an all-time favorite of mine, the Magnesium Miracle. And that's what I want to talk with her about today, about discovering the missing link to total health, reducing the risk of heart disease, preventing strokes and obesity, treating diabetes, and even improving mood and memory. So welcome back to the show, Carolyn. Are you ready to shine?
Definitely. I live in Maui, Michael, and I have to dress like this every day just to keep up with the sun and the bougainvillea and the hibiscus. I mean, everything is very shiny in Maui.
Woohoo! So it's I love what you're wearing. It's beautiful. It's colorful. For some reason, I muscle tested. I got to wear white today because usually I'm in color myself, and I'm like, man, you are so beautiful and colorful today. It's pretty awesome.
Thank you. Thank you.
So before we dive right into things, I need to say a thank you to you on air. Because last year when we started down this road, and I guess it was actually more like 15 months ago probably, we recorded last summer, I'm guessing, Jessica and I, her health was not as good as mine. My health was still a little bit squidgy around the edges, to say the least. She was struggling with mold deficiency, I wish it was deficiency, toxicity, poisoning. And the first step to getting her healthy, and she now is 100% healthy plus, the first step was getting her on magnesium. It helped her, it helped me, and even my mother-in-law, who was being told that she needed to be on diabetic medication, I make a jar of magnesium and mineral water every morning for her before she goes to work, and now they're saying no meds necessary. So, woohoo! And
yes,
thank you.
Oh, you're so welcome, and thank you for taking that step, taking the challenge in a sense to take responsibility for your own health, to imagine that you could be better with something as simple as magnesium. But yes, when we had our interview, you were blown away by the amazing list of things that magnesium is responsible for in the body. And if you don't use magnesium, you often end up on medications for the symptoms of magnesium deficiency. So, I mean, you got it right away, and you implemented a magnesium regime, and you benefited from it. So that's awesome.
We'll get into some of that list of challenges in just a little bit. I know for myself, one of them was brittle bones, of all things, where I can remember running down a hill in Maui, and I took a little tumble and I broke a few ribs. And then there was another point where I did some sort of twist in bed to get the alarm clock. This is when we were in Maui, and I broke a few ribs. And I was tested, and they said, if you were old enough, we would call it osteoporosis. You're not old enough to call it that yet. When I got on magnesium, I can't say for sure that's taking care of everything, but I had a really good tumble just a few weeks ago running on the trails. Not a problem.
Well, what's amazing about calcium and magnesium in the bones is that they're synergistic. You have to have them both. And the way I describe it is if a bone were just calcium, as doctors seem to tell us, take calcium supplements for your bones. If the bone were just calcium, like a calcium carbonate, you drop a piece of calcium carbonate chalk on a hard surface, it will shatter. So bones shatter. But if they have the requisite amount of magnesium, the bones are a little more pliable, a little more rubbery, like kids' bones. as we get older, we get less and less magnesium in our diet. We need more magnesium as we get older. So then the bones are going to suffer and get brittle. So yes, I mean, the treatment for osteoporosis is really magnesium. And that is played out, as I'm sure you've read, study after study showing that women who simply take calcium supplements are at risk for osteoporosis and heart disease. Because what happens with calcium supplements and even high calcium dairy diet, the calcium is not fully absorbed. It can cause constipation, and the excess can also precipitate into the blood vessels, causing atherosclerosis and blocking the coronary arteries, the heart arteries. It can cause gallstones, kidney stones, heel spurs, and breast tissue calcification. I don't know if we got that far in our first interview, but breast tissue calcification in a woman is bad news. Not that it's bad for you, but what happens is when you go and get that mammogram, they're going to see breast tissue calcification and think, oh my gosh, I've got to make sure it's not cancer. So you get a misdiagnosis. They actually have a name for it, DCIS. It's a pre-cancer condition, but still it's treated as if it were cancer, in that they do more mammograms and biopsies, and they say, oh, well, we've cured your cancer because we took out this little bit of calcification. So in a woman's mind, it's like, oh my gosh, I have breast cancer. I had breast cancer. I'm a breast cancer survivor. And, what does that do to the mentality of a very healthy, vibrant woman? It really brings down your energetics and your faith in your body and your faith in the world, in a sense. So I mean, it's a big deal for me, and that's why I'm going on about it.
Well, we're gonna talk, and thank you for sharing. We're gonna definitely talk today about women and magnesium, because I know Jessica's thinking it's baby time, and so there's a lot of fun stuff to talk about here. Before we do that, maybe this kind of goes along those lines. Maybe we can go back in time to maybe your third year of residency.
Mm-hmm. Well, I never went into residency. I did my third year medicine. We start to go on the floors.
Okay.
And yes, that's where I was in labor and delivery, and was seeing women in labor with high blood pressure, with fluid retention, even to the point of seizuring. And what they would do for that condition, it's called eclampsia, is they would put up an intravenous magnesium drip, and the magnesium would give the person enough diuretic function of the magnesium. It would relax the muscles. It would bring down the blood pressure. I mean, it was like a miracle. And of course, I asked, well, why don't you do that with anybody who has seizures and fluid retention, blood pressure? Oh, well, we have plenty of drugs for that. So it was a big lesson for me, and I observed it because I was already interested in nutrition, already reading all I could. This is back in the mid-'70s, for Pete's sakes. I was living in a big city that did not even have a health food store back in the mid-'70s.
Wow. So you took that information, you kind of, no pun intended, absorbed it. How did you start going down the magnesium road, and what was your health like at the time?
Well, my health was what was it? I was realizing that I couldn't eat wheat and I couldn't eat dairy, a lot of mucus. So I learned a lot from my studies. And I began to tell other people, well, you should do this, you shouldn't do that. People don't like to be told what to do. And what happened is I was in honors biology, and I just happened to be taking pre-med courses. And when some fellow students said they just got accepted into medicine, I said, oh my gosh, I could be a doctor right this minute with what I know. So actually, I marched into the Dean of Student office at my University, Dalhousie in Halifax, Nova Scotia. And there was my high school guidance teacher, Miss Elliott, who told me I could be an executive secretary or a nurse. And I said, "You've got some splaining to do, Miss Elliott." So I applied for medicine, got in. I had all the courses. I had good marks. So I went into medicine already with this background and this love of nutrition. And so when I was in labor and delivery, I knew what magnesium was. When I was in my biochemistry classes, we had 200 hours of biochemistry. I could see on the projector slides the Krebs cycle, 6 of the 8 steps of the Krebs cycle to make energy, ATP, require magnesium. And that explains it all to me. You know, when people start their sort of downhill journey into poor health, it's usually fatigue. Well, take magnesium for your ATP. They don't sleep well. They're all tense. Take magnesium to relax your muscles and to sort of balance out your adrenaline. Take magnesium to lower your heart rate to a normal level. You know, take magnesium to give you energy during the day and to help you with sleep at night. I mean, it is a miracle.
How many people do you think are magnesium deficient?
I think it's about 80%. And I say that based on the U.S. Department of Agriculture says that 80% of the adult population is not even getting the RDA of magnesium. And the RDA of magnesium is set so low that, you know, it's just so that your heart won't stop beating, for Pete's sakes. And we know the RDAs. I mean, I think the RDA for vitamin C is something like 20 milligrams, enough to keep you from getting scurvy. So the RDA is, as I discussed once, with the Office of Alternative Medicine had a conference in Washington once, and I attended. And I said, well, why don't you make it higher RDAs so that you can treat people for health conditions that are caused by nutrient deficiency? Oh, well, that's not our job. Our job is not to treat. Our job is just to make sure the general population has enough nutrients that they don't have scurvy if they don't have enough vitamin C, pellagra if they don't have enough niacin. So it's really a mistake to think that the RDA is a healthy level. I think magnesium needs to be at least twice as much as the RDA. The RDA of magnesium is like 320 to 400. And I'm telling people for therapeutic levels, go to 6 to 800 milligrams of magnesium. And while we're at it, in terms of calcium, the RDA for calcium is set like 1,200, 1,500, 2,000 milligrams.
Sounds
of
like the
calcium.
dairy industry.
Yes, good point. And these are dirt minerals. These are minerals that may be 4% absorbed. So maybe they're thinking, oh yeah, well, we have to give 2,000 to at least get 4%, 80 milligrams in the body. So it's a fool's errand. And as I said, all that extra calcium does deposit in the body. In the UK and the World Health Organization, I think it's World Health Organization. Yeah, their RDA is 600 milligrams. And that seems reasonable to me. So I tell people, there's your 1-to-1 ratio of magnesium to calcium. And look at what you can do with your diet and calcium. A good yogurt will give you like 320 milligrams of calcium. Personally, because I have such a great need for magnesium to take care of my heart palpitations, leg cramps, neck pain, back pain, insomnia. I have such a need for magnesium. If I eat a quart of yogurt over a 2-3 day period, I start to get my heart palpitations back because the calcium will kind of neutralize out the magnesium. So I have to increase my magnesium. So that's how how much in balance our bodies should be. And this is where I can say to people when they'll tell me, well, I went out to get a suntan and I all of a sudden needed more magnesium. Oh, well, that's easy. You got vitamin D.
Yeah.
The vitamin D grabbed more calcium. That more calcium bumped out your magnesium, so you need more magnesium. And to sidebar into vitamin D, this is what kind of really drives me crazy about the high dose vitamin D that's being recommended now, is people have no idea that the higher the amount of vitamin D, the more magnesium is utilized. When you have storage form of vitamin D in supplements or stored in the body, it requires extra magnesium in order to activate it. So the more vitamin D you take, the more magnesium you use up. And the set point for vitamin D, the average that people say you have, it's, oh, we should have more and more vitamin D. I'm very against that.
Mm-hmm.
I think if we stay at the low normal levels of vitamin D, we do much better, along with a balance of magnesium and some sunlight. And let's get a food-based vitamin D. I use a fermented cod liver oil and butter oil combination rather than sheep lanolin, which is what they say the natural vitamin D is these days.
Isn't that used for softening leather products? So you struck an interesting chord, because I really wanted to ask why we're magnesium deficient. What just fits in with that is you said more sunlight equals more vitamin D equals more need for magnesium. And in the natural cycle of the planet, if we were getting more sunlight and getting that more vitamin D, we would have access to more plants and greens, where we naturally at that point of the year would be getting more magnesium if it was still in the soil.
Exactly. And that's where, I don't know if you saw a recent blog I did, food is not medicine. You know, the old Dr. Beeler, all the books that food is your medicine. And, all the young practitioners now are writing these books. Oh, yeah, we have to go natural, go raw, go paleo, eat a lot of greens, and we'll get all our nutrients. Well, that ship has sailed. We really cannot. Unless your farmer is, biodynamic, organic, puts rock dust on, and measures the amount of minerals in the soil. And the reason why I say that, and I told you this last time, Michael, I get people who are on these 40 ounces of green drink a day and eating raw and all the rest of it. And they come to me with their heart palpitations and leg cramps. And I put them on my magnesium. And within a day, because they're so healthy anyway, within a day, their symptoms are gone. So I'm proving it all the time that an excellent diet is not enough anymore. And you proved that too, Michael. You and Jessica were on an excellent diet when I met you. But as you said, you really needed more magnesium than you thought you were getting.
How can we tell if we are magnesium deficient? Are there certain, you were mentioning leg cramps and a few others. What are some key signs for us?
Well, head to toe, it's headaches, even migraines. It's eye twitches or, facial muscle twitches.
I used to get those before the magnesium. I called that my red line. My eye would just start twitching on me.
Right. Throat spasms, where people, they say, oh, I can't swallow pills. They make me choke. People will say, oh, that's emotional. But it's all about, in the symptoms I've mentioned, the muscles and the nerves being so irritated from a lack of magnesium and too much calcium. The whole thing about magnesium, calcium goes down to the cellular level, where the cells have way more magnesium than calcium. Magnesium allows the calcium to come in, a little bit of calcium to fire the nerve or fire the muscle action potential, and then magnesium kicks the calcium out. If you don't have enough magnesium, calcium will flood the cells, cause muscles to twitch and spasm, or cause nerves to tingle and go numb. So, those are a lot of our, neurological symptoms and our musculoskeletal symptoms. So then you get to the heart, which is a big muscle. When that goes into spasm, you get angina and even a heart attack. Athletes prove this all the time because they get so depleted of their minerals, especially magnesium, sweating, replacing with sugared Gatorade, which is just salt and sugar. And the heart will finally just go into a severe spasm. I've written a book on atrial fibrillation and have numerous cases of people who will tell me, I don't even hear about the people who don't report to me, that taking a good therapeutic magnesium actually calms down their electrical system. Because what makes the electrical activity in the brain and the heart are electrolytes. What is the most important electrolyte? Magnesium. But if you look on a blood panel, you don't see magnesium even measured. They'll measure sodium, potassium, calcium, chloride. And your question, I think, that you asked me about an hour ago was about testing for magnesium. So here we are at the testing point. So the doctors, they just use a serum magnesium test. There's only 1% of the magnesium in the whole body is in the serum. Okay. So you're not getting anywhere near an accurate measure. And that little percentage of magnesium, it stays at a very balanced level all the time to protect the heart, which means if you get magnesium deficient, your body, through biofeedback mechanisms, will pull magnesium out of your bones, out of your muscles, keep it in the bloodstream to protect your heart. So over time, doctors say, wow, we measure magnesium all the time and it's always the same, so the body is taking care of it. It's fine. So they ignore the test. I tell people to at least get a magnesium RBC test. It's a magnesium red blood cell test, and they can order that online. People can check my resources, and it's not my lab or anything, but it's called Request a Test. They can get a magnesium RBC test for $49, which is less than your doctor's copay. And then you get your value. But big caveat here, because in the red blood cells, there are no mitochondria. It's in the mitochondria where most of our magnesium resides. That's where the ATP is made. That's where the Krebs cycle occurs. So the red blood cells, they are a better measure than serum. I really like the ionized magnesium test, but it's only a research tool, so it's not available. So I tell people, well, get your magnesium RBC test. You can see, where you are. You can follow your progress of magnesium therapy, but it's not the end-all and be-all. What is the end-all and be-all? It's how you feel. And then that comes to lists of the magnesium deficiency symptoms. I have a list of 100 factors that can let you know you're deficient in magnesium. 100 factors.
If we go to, we don't want to cover all 100 today, but we got through, we kind of started at the head. We got through, I think we started to get through the heart. If we kind of take it the rest of the way down the body.
Right. So even hiatus hernia, acid reflux, that could be a spasming of the stomach or the lower esophageal sphincter. People say that their heartburn improves when they get their magnesium. Colitis and Crohn's and IBS, GI symptoms where the gut is in spasm, that will relax. Constipation, the muscles that tighten up from magnesium deficiency, when they're relaxed, the bowel movements improve. And it's not necessarily the laxative effect. The magnesium I work with is non-laxative, and even the non-laxative magnesium that I use relaxes the gastrointestinal tract so that it's relieved of esophageal spasms, heartburn, acid reflux spasms, and the gut spasms. Bladder symptoms. Some women have spastic bladder. It's given that name, and the magnesium will treat that. Some women, I've had reports of older women who've been on adult diapers who take magnesium therapeutic amounts and say, wow, I don't need my adult diapers anymore.
Yay.
And what's happening there is that there's a calcification that can occur in the bladder lining or at the bladder sphincter. And when that calcification dissolves, because magnesium will solubilize calcium, then the symptoms go. Back to arteries, the carotid arteries. I've had people on therapeutic magnesium where their ultrasound for their calcification of their carotid arteries, that is reduced. The last report was 30 to 40% reduction after a few months of magnesium. Kidneys. We hear so much about kidney disease and what can you do for kidney disease? What do doctors do? They say, oh, well, when your glomerular filtration rate gets abnormal, what's going to happen is you're going to get high blood pressure, you're going to get cholesterol, you're going to get diabetes. So we'll give you those drugs to prevent those associated conditions. And of course, everything just gets worse. So with the kidneys, what I'm speculating, and I know it's true because they're starting to do a lot of research on this, the kidney arteries are getting calcified, just like the carotid arteries, just like the coronary arteries. But because the doctors can't go in and put a stent in the carotid or the coronary or replace the coronary arteries, they can't do that with the kidneys. They just say, okay, well, all we can do is give you drugs. But if you take magnesium, your kidney filtration rate will improve. You'll be off the kidney transplant list. Then, with legs and arm spasms, and not so much, but the legs, there's huge problems with leg muscle spasms that people tell me about, and that will be overturned with the proper amounts of magnesium.
So I guess what we want to do from here, and we want to go into some of these different conditions. Do you think we need a little bit of background, just the briefest Magnesium 101, or how many different things magnesium affects in the body?
Yes. What's amazing about magnesium is that it's required for 700 to 800 different enzyme systems in the body. And that's a lot of biochemical processes. So from head to toe, as we mentioned, headaches right down to toe spasms, magnesium is vital for the body. And it's not something that I was taught in medical school. It's not taught in schools. So what happens is people and doctors not realizing that their headache or fatigue or their cramps are caused by magnesium deficiency, they will end up taking medications. And then, as we know from most drugs, they will deplete magnesium. We even have a black box warning on Cipro now. And Cipro will cause magnesium deficiency, and it will cause tendon rupture. And I say the tendon rupture occurs because there's so much spasming that can be created by the magnesium deficiency of Cipro, and the added effect that Cipro is a fluoride drug, and the fluoride in Cipro can bind to magnesium and make a brittle compound called magnesium fluoride, which will deposit in tendons and muscles and bone. And in the tendons, then it can cause rupture.
Would you mind telling us your feelings about Tim Russert and what happened with his passing away?
Yes, Tim Russert, he was a commentator on the media, and he had heart disease. And when I found out that he died, and I looked at the articles on him, what he'd been through, he'd had symptoms of coronary artery disease, was put on a whole list of drugs, and And the scenario I imagined from his story was that he's under a lot of stress and pressure, so he's burning up magnesium. He goes to the doctor. His blood pressure is elevated. The doctor says, "Yes, you're under stress, but there are things we can do for your high blood pressure. Let's give you a diuretic. A diuretic will drain more minerals, drain your magnesium." Russell comes back to the doctor and his blood pressure is even more elevated. The doctor says, "Oh, we caught it just in time," and he's given a calcium channel blocker. And they seem to realize that calcium needs to be blocked, but they don't realize that magnesium is a natural calcium channel blocker. And they'll give an ACE inhibitor, which is another drug that works kind of on the kidneys regarding blood pressure. Anyway, after another couple of months, you go to the doctor, you're on these three drugs, a diuretic, a calcium channel blocker, an ACE inhibitor, and your blood pressure is really not that much better, but you've now got high cholesterol and high blood sugar. These are two conditions that are caused by magnesium deficiency. In cholesterol, in order to either stop the production or start the production of cholesterol, you need magnesium. So if you need more cholesterol, the magnesium does that. If you need less, the magnesium shuts things off. Instead of using magnesium, doctors use statin drugs.
Mm-hmm.
Statins have fluoride molecules, so you'll get what I mentioned with the Cipro, you'll get the binding of magnesium with fluoride, making the magnesium not available. So more and more magnesium is wasted. Diabetes, one of the signs of diabetes is low magnesium. Doctors don't pay any attention to that. So you've got this scenario where all these drugs now are causing more and more problems. And it explains why doctors say, well, once you get coronary artery disease, once you get atrial fibrillation, etc., there's no coming back from it. You just have to stay on these drugs for life. And the doctors don't have a clue that they're causing the problem. It's very distressing.
Let's go to more of a positive side then. We'll come back to some, unfortunately, of the distressing, but with a positive note to it. But let's talk about women and fertility and then pregnancy.
Yes, I've had many cases of women who said they've been infertile, have not been able to get pregnant. They start taking magnesium and did not expect to get pregnant, but they did. And the explanation there is that if you're magnesium deficient, your fallopian tubes that process the egg and the sperm and do all their good work, the fallopian tubes, if they're in spasm from magnesium deficiency, they're not going to do what they're supposed to do. So there is one reason. Also, I mean, just in terms of sex and orgasm, if you're magnesium deficient, you're going to be tight and tense. Your vaginal muscles are going to be tight and tense. I've had many people, even 70-year-old women, tell me that once they started magnesium, their painful intercourse was gone and they were able to enjoy themselves. So there's that aspect of sex and fertility. In terms of pregnancy, I mean, it's been known for centuries that women need magnesium. And what they took was the salts, which is Epsom salt. Mm-hmm. And midwives know about it. They'll tell their clients and patients to take magnesium. What doctors do, they'll tell a woman to take a prenatal that has some magnesium in it. They don't really recommend magnesium alone. If they do recommend magnesium, not just in pregnancy, but in all cases, most doctors look to magnesium oxide. And what's crazy about magnesium oxide is it's only 4% absorbed. So it causes constipation. It causes diarrhea and treats constipation. So most doctors look at magnesium, it's just a laxative, and they push it aside. So it's, again, unfortunate. There's a magnesium that someone asked me about the other day on Facebook called Slow Mag, mm-hmm. and she said she felt very bad after taking it. And what's going on with ReMag is it's 2 times the amount of calcium to the amount of magnesium in this product. So it's really a calcium supplement, which will further knock down, drive out your magnesium. Besides that, it's got about a dozen drugs and chemicals in it for who knows what reason. So including what talc and polyethylene glycol or something like that. So there's so many reasons to look at more natural forms of magnesium than the ones that are in the drugstores, or the ones like magnesium oxide where most of the studies have been done. I think that's why doctors know about magnesium oxide. But what happened there, the story is that a very smart magnesium oxide company gave a lot of free magnesium oxide to magnesium researchers back in the day, and therefore most of the research was on magnesium oxide.
So going from there, just one more question on the pregnancy side of things. It got me thinking, first off, can we have babies that in utero are magnesium deficiency and deficient? And conversely, if a woman who's lactating takes magnesium, I mean, that sounds like a great way to balance calcium getting into the baby's growing bones.
Absolutely. In the Magnesium Miracle book, in my chapter about pregnancy, I talk about children born with cystic fibrosis who it's said that it may be caused because of magnesium deficiency. I can't say definitively, but certainly problematic deliveries can be attributed to magnesium deficiency. And you can imagine, I mean, that the whole vaginal area that has to be in a relaxed state in order to birth a 7 or 8 pound baby, and magnesium makes it much more comfortable. So there are a lot of conditions. I mean, they talk about even the IQ being improved in women whose magnesium levels were higher than another group where the babies had a lower birth weight or not such a good outcome. I'm trying to remember the statistics, and I won't be able to, but people can refer to that chapter in the book, in the Magnesium Miracle book. And it's vitally important for women who are pregnant and who are breastfeeding to take sufficient amounts of magnesium.
Thank you. From there, let's talk about some of the other conditions here, and then we'll talk about how we get magnesium into us. First off, anxiety and depression.
Yes, I just finished a booklet on anxiety, and I was reluctant to write it for a long while because I didn't want people to think, well, you're horribly anxious, all you have to do is take magnesium. But the more and more reports I got, I was just blown away. I think I have 16 case histories in the book of people who were taking magnesium maybe for their heart condition or their migraines or some other insomnia, energy, etc. And they reported, oh my gosh, my anxiety's gone, my panic attacks are gone. So there are many layers to what happens in the body. The magnesium, it supports the adrenal glands. So if you're magnesium deficient, your adrenals will spurt out adrenaline erratically, so that if you get a spurt of adrenaline that races your heart or makes you feel anxious, the fight or flight symptoms, if you're in the middle of driving across a bridge or doing something that's a bit scary and you get this adrenaline surge, then you're gonna think, oh my gosh, I'm having a panic attack. You explain that to a doctor. Oh yes, you're having a panic attack. Here, take this anti-anxiety. Take Xanax or Ativan. And people are on these drugs then for years, thinking that they have some sort of undecipherable panic attack. Low blood sugar. If you skip a meal, etc., your blood sugar goes low. And the body's mechanism to deal with a low blood sugar is to push out some adrenaline to get to the liver to open up the glycogen stores. Glycogen is stored glucose, and that brings your blood sugar back up. But in the meantime, that adrenaline is going to speed up your heart. And again, if you're in a situation, even in an elevator, a closed space, you're going to get claustrophobic because your heart's racing, you may sweat a bit. So anxiety is a learned condition for a lot of people. You can be in a home where you're fearful and anxious. You're trying to please a parent who may have bipolar. And you don't want to get get yelled at, or whatever happens in the dynamic of creating a panic and anxiety. It can be worse if you're magnesium deficient. So to me, it's the most important nutrient to take if you're anxious. Depression, there's evidence as well with depression. One of the feel-good neurotransmitter, serotonin, it requires magnesium in order to produce it, to transport it, and to bring it where it's required in the brain or the gut. So there's a lot to the whole mild depression and magnesium treatment. I haven't written a booklet on depression. I don't like to imply to people again that it's just a magnesium deficiency, because even though I believe depression is biochemical, it can lead people to do homicidal, suicidal things. So I don't want to imply to people that it's just about magnesium. The product that I do recommend, and it's mainly a mega multiple vitamin and mineral with amino acids that has been tested, compared to drugs for many years, and they've got dozens of studies that show it's more effective than antidepressant medication.
You cut out right while giving the name of that. Could you give that one more time?
The nutrients that I do recommend for
it was
depression,
something EM Power or something?
Yes, is called EM Power Plus, Empower Plus by TrueHope.com. And they've done dozens of studies, compared their nutrients, which is high vitamins, minerals, and amino acids, and compared to antidepressants, they have like an 80% recovery, and drugs have a 40% recovery, which is comparative to the placebo effect.
So thank you. From there, we'll talk about a few more other key ones. One that a lot of kids are coming down with these days, which is asthma.
Yes, well, asthma, it's in and out of our society. What is it? Is it a dust allergy, plant allergy? Is it ragweed? Is it your pets, your cat or dog? Well, everybody's exposed to those things. Why do some people suffer? And I think some people suffer because if you don't have enough magnesium, then the smooth muscles lining your bronchial tracts can go into spasm. And if you cough a little bit because of dust or cat hairs, then if you're magnesium deficient, that cough can trigger a spasm of your bronchial airways, and then more and more coughing, etc. It can lead to wheezing. There's an anxiety component to asthma as well, because as soon as you start feeling that you're not getting deep breath, if you feel that your lungs are going into spasm, you'll start hyperventilating, etc., and just increase the condition. If you're an anxious person, then you have to look at being magnesium deficient. Yes, I've had many parents who tell me that when their children start taking magnesium, their asthma symptoms diminish and go away. And oftentimes with asthma and in colds, these children are put on a lot of antibiotics. That seems to be, have an ear infection, take an antibiotic. Your lungs, you might have bronchitis, or we don't want you to get pneumonia, take an antibiotic. So a lot of these children are developing yeast overgrowth, and that can lead to a lot of yeast toxins that can actually cause a drain on magnesium. So I highly recommend yeast-free diet, lots of garlic, good probiotics to stay away from yeast overgrowth syndrome.
Thank you, thank you, thank you. So from there, one that was been successful for us that I'm not sure how Jessica feels about me sharing. I'm guessing she'd be okay with it. She didn't have PMS, but she had horrible, horrible cramps. And the cramps really got better after we started on, or she started on magnesium.
Right, right. Well, yes, when you think of cramping, that's going to be muscles in spasm. And, you know, when your period is flowing out of the uterus through a tiny, tiny little opening in the cervix, it's going to cause some pressure. And, you know, the pushback of that pressure can be the muscles clamping down a bit. If the muscles are deficient in magnesium, they are going to go into spasm. It's a basic body physiology. And yes, if you are sufficiently repleted with your magnesium, and I just don't mean, you know, enough magnesium to replace what you lose every day, you know, in urine or feces or what you're burning off, but you need magnesium stores. You need to know that if you don't take your magnesium for a couple of days, you've got enough magnesium to last you. Heaven forbid, if you have an accident or if you have surgery. I recently had ear surgery, and I made sure I took a lot of magnesium, and I was concerned. I didn't want to take a general anesthetic because a lot of them are fluoride anesthetics. And I did a local anesthetic, and they drilled in my ear. But anyway, I was concerned because on the operating table, I did not want to relive my heart palpitations. And then they would say, "Oh, you have a heart condition, and we're going to give you all this arrhythmia medication." So this is what, I know I'm kind of sidebarring again, but I've had so many people say to me that I've never been well since I had that surgery. And well, what happens under the stress of surgery? You'll burn off your magnesium, and then you could end up with cramping and heart palpitations, and then be told you have another medical condition.
Fascinating. It's got me thinking of my blood transfusions I had years ago after my surgery. Let's talk about, you mentioned briefly headaches, so maybe we could talk headaches and specifically migraines.
Yes, it's amazing with migraines. I mean, I remember when I was in practice, a woman had the most severe migraines, and when I took her history, when did her migraine start? After she was hit in the head with a baseball bat.
Ooh.
And I said, "Well, didn't your doctors mention that could have been the cause?" "Oh no, they didn't." They didn't think it's related anymore. But of course, with that, I mean, with being a naturopath and a medical doctor, I said, okay, you need homeopathic arnica to deal with past trauma. You need magnesium to deal with, the cranial bones being so tense. You need craniosacral therapy. I mean, there's so many things we can do when we know the history. But with migraines in general, I mean, it's the tension in the arteries around the scalp for one thing, and that can be relieved with magnesium. There's different neurotransmitters and biochemistry that create a migraine symptom, and that can be worked on by magnesium. I mean, I'm trying to think of all the layers that are affected by magnesium, but the final outcome is that 99% of people who get therapeutic amounts of magnesium, their migraines are a thing of the past. What I also recommend, one of the other products I work with has methylated B vitamins, and vitamin B6 is very important to treat migraines. With headaches themselves, that's more muscle spasms, often coming from the back of the neck. People with their, typing on their computers like I do, So the tension up the back of the neck. Now, that type of tension as well, I've heard a lot of people say that, oh, I have this nerve tingling, that just grabs me up the back of my neck. Well, that's magnesium deficiency as well. We're telling people to spray my magnesium on muscle spasm areas to also get the transdermal effect. So migraines and headaches, they are very amenable to magnesium therapy.
Jessica used to get headaches. She doesn't get them as much anymore, but sometimes she does, and we're going to guess that they're tension headaches. She's had trouble with the mouse and her arm that uses the mouse. We went from a clicky mouse to a roller mouse to use a pen as a mouse. I'm wondering maybe if we need some topical magnesium on her on those areas, or any thoughts?
Yes, I mean, I think I would have those problems too, but I use a laptop so that, my wrists are on the base of the laptop, and there's not a lot of action. When you use a mouse, I think you have more action. But yes, we tell people with either carpal tunnel or this outlet here of all the nerves that come down the arm, yes, to apply magnesium. It's in a layering process that works best. So you spray magnesium on and let it dry, then spray it on, let it dry. Do that, 4 or 5 times, and that will allow the magnesium to saturate the muscles and relax them. And also even, Epsom salts baths. Every time Jessica takes a bath, just put in a couple of pounds of Epsom salts. It's usually 1 or 2 cups, but I think a couple of pounds would really help.
I like it. This sounds like I'd never thought about, made this connection before, and I want to get into different types of magnesium in a second, but I never made the connection between maybe athletic recovery and magnesium other than Epsom salts. But you're saying maybe we could spray muscles or spray joints or spray hot spots with magnesium. Does that sound right? After workouts, or if there's something that's sore?
Oh, absolutely. But it's just as good, the reports of people who tell me it's just as good to take your magnesium, your sea salted water, and your multiple minerals in your drinking water, before, during, and after a run. And then you don't even develop lactic acidosis in your muscles, or there's no real recovery time. I mean, people tell me this every day.
Thank you. From there, what are the different types of magnesium? What is pico magnesium, if I have that right, which is, I guess, what I've been taking on a daily basis?
Right. Well, in my first couple of editions of Magnesium Miracle, I listed all the magnesium products, and it just got, as people wrote to me, it got too confusing for them. There's the magnesium oxide that I tell people it's only if you're majorly constipated would you even use it. There are magnesium chelates, which advertise that they're much better absorbed, but the absorption may be up to 20%. Even the glycinates, it's said that they are non-laxative magnesium, but they're mainly coated with substance that makes them even hard to digest. So what I narrowed it down to in my last edition of Magnesium Miracle is Epsom salt baths, and that can grab a person and let them know, look, you can do something externally, you feel so much better, magnesium is helping you. The second one is my magnesium ReMag, which is the picometer stabilized ionic form of magnesium that's 100% absorbed into the cells. You don't even need a digestive tract to make it work for you. All the people with leaky gut say, oh, I can't take anything. Well, these are minerals you can take and help heal your leaky gut. And then I also recommend magnesium citrate powder, the natural calm for people. It gives me the laxative effect, but some people need it for the laxative effect. So I tell people to take all 3, but it's with the ReMag, the 100% absorbed, taking 300, 600, even 900 milligrams, that I'm getting people off their heart medications, off their arrhythmia medications. They're getting off the kidney transplant list.
Wow.
People who've been forced to have indwelling catheters in their arm or their neck for IV administration for their severe magnesium deficiency, but they can't take oral magnesium because it gives them the laxative effect. They're switching over from IV magnesium to ReMag. It is that effective, and it's so well absorbed and with no laxative effect. So I'm actually at a stage in my life where I've been looking for something to help people for a long time. It makes me think of this Buckminster Fuller quote that I'll read out to you. Fuller said, "You never change things by fighting the existing reality. To change something, build a new model that makes the existing model obsolete." So what I realized is, I'm giving all this information out. I see health sites giving out a lot of information. Well, people really need something in their hand, and they don't need to go to a site that has 100 different products and then they don't know what to do with them. So as I've been telling you, Michael, I just built a protocol with my ReMag magnesium, my ReMite multiple minerals. I tell people to put sea salt in their drinking water. I have a gentle detox with methylated Bs and a couple of amino acids to make methionine. I have a protein powder now that is awesome. I have RNA drops that make new perfect cells. So I have this small handful of nutrients, and they're working so well. It's to the point where my huge busy consulting practice, I just shut it down, because what would happen is everybody that came to me, they'd end up on all my products, and I'd say, well, you don't need to pay a consultation. Just buy the products and take them and get back to me.
Is there such a thing as taking, because you mentioned before, it kind of raised a alert for a question, that your Pico Magnesium and ReMag is 100% absorbable. So is there the potential of taking too much?
That's a good question, and that's what I studied right from the beginning. And what I found is when I first started taking my ReMag, I finally got rid of my heart palpitations and leg cramps. And when I tested the amounts, there was a certain point where I did get the laxative effect. And now I need about half as much as I started out with. And if I take a half a teaspoon more, I get the laxative effect.
Is there such a thing as well, I'm kind of leading the witness here. We know that food can't fully be thy medicine, but what does a magnesium eating plan look like?
Well, that includes seaweeds. There's 3 times the magnesium in ocean water than there is calcium. It's dark chocolate. And yes, so that's very helpful. You have women who say, oh, I get this craving for chocolate before my period. Well, they're craving magnesium. And actually, the chocolate craving does go away when they are saturated with magnesium. And they're nuts and seeds, they're whole grains. But the soil does have to have the magnesium. And see what's happened lately with people avoiding more and more grains, and I think women especially, they don't eat nuts because they think they're fattening. I mean, who's eating seaweed? And chocolate may be the only source of magnesium for most people. So it's difficult because there's no labels on a piece of fruit or vegetable to say what nutrients are in that fruit or vegetable. So that's why I tell people, look at the 100 factors that create magnesium deficiency, and you can just Google 100 factors magnesium in my name and see them all, and just get used to what your magnesium deficiency symptoms may be. And then as you take magnesium and get yourself saturated, and you feel better. You just tick off, oh, okay, no more twitching. Oh, I'm sleeping better. Oh, that nagging back pain is gone. And just prove it to yourself. And, that's part of taking responsibility for your own health, where, you really analyze and assess your body, not in a paranoid way, but especially with magnesium, in a way that you're just amazed that day to day you feel so much better.
I apologize now for the crinkling. My kitty in the studio, because my wife is overseas right now, so he has joined me in the studio. He's trying to get my attention. We're going to ignore him because we've just got a few more minutes, Meowsers. Just a few more minutes. One last, before we start to wrap things up, one last symptom or piece I'd like to address, both for my father-in-law and for my dad, is hypertension or high blood pressure.
Yes, I alluded to it in the Tim Russert sequence. The blood vessels.
I apologize. It won't be picked up by this microphone. He is needing a piece of... Do you want to get on camera here for a minute?
Yes, bring him up.
People are always curious about you because this is not the first time this has happened. And this is a good Hawaiian kitty cat. His name is Sir Meowsers.
Whoa.
And he has quite the presence, quite the mana. He was a semi-feral cat when I was outside on Maui doing a meditation, legs crossed, eyes closed, and he appeared in my lap. He, I think, bit me a few minutes after that, just because I was petting him too much, but then he said, "You're mine."
Oh, wow.
And he took ownership of us.
He looks like you. The dark hair and the white eyes. It's perfect.
What do you think, Meowsers? Is there a connection?
I think so.
So if he's distracting, I'll put him down. If not,
he's fine.
Okay. So hypertension. This seems like an important one that maybe magnesium could really help with.
Yes, and that's sort of where people start on the downward spiral of their health. Okay. The blood vessels are surrounded by smooth muscles. Mm-hmm. It opens them and closes them down. I mean, you have to have something creating the wall boundary of the blood vessels. So what happens if you're magnesium deficient? Those smooth muscles can go into spasm, tighten up, and clamp down on some of your blood vessels, which will drive up your blood pressure. It's very simple. And then the doctor, sort of takes over, and you end up on your diuretics, calcium channel blockers, and ACE inhibitors, and then you end up with high cholesterol and high blood sugar. So the way to work with magnesium and hypertension is you have to know, don't stop your medications. It's not a matter of, you got to stop your medications before you start something healthy. No, magnesium is like food. You wouldn't stop eating your food. So you start slowly introducing magnesium and alert the person that, look, this magnesium is going to heal your blood vessels and heal your hypertension. So be aware of your blood pressure, do home monitoring. And as your blood pressure decreases, go to your doctor and say, oh, look, I'm getting better. Aren't you happy? Wouldn't you like to help me reduce my blood pressure medications? Isn't that what you were trained for in medical school, that people should just take medications only if they really required them, not for prevention? So that's how I deal with hypertension.
Thank you. What advice would you give to parents to help their kids stay with healthy levels of magnesium through their childhood?
Well, I really focused on this when I was dealing with autism when I lived in Manhattan. And basically every child gets a bath every day. So you do the Epsom salts. So you put a couple of cups of the Epsom salts in their nightly bath, and it helps them sleep. It helps their bowel movements. In the autistic population, there's less behavioral traits with magnesium. It's quite amazing. And then as they get older, you put a liquid magnesium in their drinking water. With athletics, you really have to educate them about taking their magnesium water. Someone asked me recently, would you write something about teens and what they should eat and how they should get their magnesium? I said, forget about it. You cannot force a teen to eat anything other than chips and hamburgers. But what you can do is spike their water bottles with my liquid ReMag and the multiple mineral ReMite, and if they can tolerate it, some sea salt, and prove it to themselves that they feel so much better after their game. I mean, I've had a lot of teenage athletes whose parents have approached me, and maybe if they weren't in so much distress, they wouldn't have done it. But once they do the mineral treatment, they feel so much better.
Woohoo! And,
yeah.
And Meowsers is celebrating too.
Yes, I hear. Wonderful.
So from there, just a few wrap-up questions, and then we'll let you get going since it is Halloween and it's going to be a fun day today. This is a question I believe we asked you last time, but it's fun to ask again. What personally brings you the greatest happiness, or what I call the woohoo factor?
What person?
What personally? What brings you?
I was going to say
what person? Well, certainly.
That's my husband, of course. Personally, the great. When I have a great interview, when I produce a great booklet on magnesium, I really love writing. When I produce a great blog, when I get the information out there that people will share and pass on. I really love sharing information, and I don't need any feedback about it. It just makes me feel good.
That is a woohoo! So, yay!
Aww.
Where can people go to find out more, to find your products, and to find your books?
Okay, drcarolyndean.com. Join my newsletter, free newsletter. My product website is rnareset.com, and you can Google my name, and I'm everywhere. I've done about 1,000 blogs and articles, and a lot of them are on magnesium, but I'll keep doing it until everybody out there is taking magnesium, and hopefully most of them are taking my ReMag because it is the best. It's the most therapeutic. So I thank you very much for allowing me to say all that and to be on your podcast. And I wish you and Jessica all the best and your future family on magnesium.
Thank you, Carolyn. I always have to ask, so forgive me if you don't have any last words, but any last words of wisdom you wish to share?
Take responsibility for your own health because nobody else is going to do that for you.
Amen. Thank you so much, Carolyn. This has been a true honor, a pleasure, and a treat, and we are doing this on a daily basis. It has made a big difference. Everyone out there, get the Magnesium Miracle. Check it out for yourself. For everyone out there, this is Michael Sandler saying, be well, have fun, get the Magnesium Miracle, put that magnesium back in your body where it belongs, and shine bright. Woohoo!
Woohoo!
Thank you. This was a treat.
Aww.
Thanks so much for watching. If you enjoyed it, be sure to like below. Also, leave your comments. Have some real fun with it. Subscribe to our channel where you're going to get more great videos, more interviews coming up. And check out our website, inspirenationshow.com. That's where you'll find tips, blogs, information, videos you won't find anywhere else, and useful and helpful resources to really help you kickstart your life and to shine bright. Thanks so much again. Thank you for your support. Like, comment, subscribe. See the website. Thanks so much and have fun. Of course, shine bright. Woohoo!